And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So supplements and vitamins, wasting your money?
Well, we've talked about this before. This comes up all the time. Personally, for me, what I've read and what I know about medicine and just health in general, I'm not a big fan of taking a bunch of vitamins and minerals every single day. I think you should get those vitamins and minerals in the food that you eat, the vegetables, green leafy vegetables, nuts, fish. And trying to avoid those foods that don't have any nutrients in them is really the way I think about it. But there are a lot of patients who believe in these vitamins and minerals. I'm not going to take that away from them. As long as they're not having any side effects from the medication, go ahead and take it. But the science, the medical literature just doesn't support it. The studies are not there for doctors to recommend that, so we just don't recommend it. But everyone,
if you like to spend your money.
Well, everyone does their own research, and if they feel like it's helping them, by all means, take it.
All right, we've got lots of questions, so let's get to them. The first one, having ligament ankle surgery on Wednesday. Someone has to be with me for the first 12 hours. And after, why? Well,
it's surgery, and they're probably going to use some sort of anesthesia, strong pain medication. Your thinking processes are not going to be clear, i.e. you cannot drive, or driving will not be a good thing to do.
Won't you be in the hospital, though?
Well, a lot of people are doing outpatient procedures now at these surgical centers, so you're not necessarily in the hospital, day surgeries. That's where the whole industry is moving, to try to get you out of the hospital, try to do day surgeries, outpatient things. So that's probably why, they're not going to be in a position where they can drive a car.
Okay. Another question. My 3-year-old daughter has had a bad cough for the past 3 days. She coughs a lot during the day and at night. Is there something I can do or give her that may help her get over this cough quickly?
Well, if the cough doesn't go away, that's a good sign to get back with the doctor. Could be something that's going on. You can try over-the-counter products. She could have asthma. She could have something in her chest, in her vocal cords that's causing this coughing. So certainly we like for patients to get back with the doctor to get a better exam to exclude those other issues.
Are there different types of coughs?
There are different causes of cough, absolutely. Asthma, acid reflux, in 3-year-olds who I don't treat all the time, not quite sure about all of the differential with coughing, but coughing is coughing, okay? So,
well, there is a croup cough, though,
absolutely,
which is totally different.
Absolutely, but it has a characteristic noise, and most patients and patients' family will say, whoa, that's a different cough, and they know something's wrong. Most of the time, it's not of that nature, and it's just the old garden variety coughing. Coughing is very irritating. You can't...
No wet or dry cough? I mean, do you need to distinguish the difference?
Not necessarily. Not in my line of work. If they're coughing, and we still have to look for the cause. Certainly other things about the cough, other symptoms. If they have fever, if they're coughing up blood, if they have other medical problems on certain medicines, then you can kind of put it together.
Okay. How do you know if you have the flu?
A lot of times you can do a flu test. They can do a throat swab and check for A and B in the throat symptoms, fever, severe achiness, dry cough, sudden onset. That's the flu.
Okay. How long can the flu virus be active if you work in the public and you are exposed to someone with it?
I think for a week, in my opinion, because it's a respiratory droplet. It gets into the air, gets on the surfaces, and I say a week is kind of a good period of time to maybe try and stay away from the general public, quarantine yourself, if you will, if you can. Some people can't, have bills to pay as Christmas. Certainly get your doctor for some medication and get your flu shot.
And how often should you wash your hands?
As often as possible. Cough into your elbow.
Should you wear gloves?
Well, yeah, you can. People might look at you a little funny, but you can wear gloves.
Or a mask when you go Christmas shopping?
Even with the mask, it may bring a little bit too much attention to you, but obviously, yeah, you can do all those things.
All right, we've got lots of other questions. We'll get to those in just a minute. Don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person wants to know, does milk make you fat?
Not necessarily. A lot of different milk varieties out there. Certainly, we don't like whole milk, too much fat, too much cholesterol issues, so 1%, 2%, but they have almond milk out there, which is a different taste. They have soy milk, which is what I drink, and after you get accustomed to the taste, it's actually very good. I like it. It's difficult for me to drink cow milk now.
Really?
Absolutely. So
all right.
I think if you drink anything in excess, other than water, yeah, gaining weight probably.
You can drink as much water as you want.
Yeah, to a certain degree.
Okay.
Yes.
When a person doesn't allow a child to be vaccinated, can the child go to school?
I don't know. I mean, the school district typically has rules and regulations to control those issues, and parents should just call. But a lot of times the schools will tell them if the kids can't come. So I don't know that, but just check with the school district.
A 51-year-old woman, the soles on her feet are burning. When she lays in bed, the weight of the covers hurt her feet, and she's not diabetic.
Yeah, good old neuropathy strikes again, you know. A lot of times arthritis in the foot can cause compression of the nerves in the foot and cause the burning. Poor circulation, medications, sometimes the cholesterol medicines are culprits of that. Idiopathic is also a big cause, meaning we don't know what causes that. But there's some good medications on the market, Lyrica, Elavil, gabapentin, to name a few.
Okay. How long can the flu virus be active? Oh, we've read that one, sorry. Having major pain in the right side, they say that it could be my ovaries. What should this person do?
I'm assuming that that's the abdominal area, and for females, so many different things that could be in there. We're going to have to do CAT scans to figure that out because it could just be constipation, could be gallbladder, could be gynecological. So I would probably do a CAT scan.
Okay. This person says, if the shoulder cuff is torn 80%, is there any chance of it healing if it's just rested?
Probably not. That's a big percentage. Typically, if it was maybe 10%, maybe it could heal on its own if it wasn't re-injured. But typically, if it's 80%, they normally want to do some sort of surgery.
Okay. My fiance and I are planning to get pregnant early next year. She has a torn rectus abdominis muscle giving her issues. Is that going to create a problem getting her pregnant?
It shouldn't, because muscle heals, forms scar tissue. Could be a vulnerable area, however, it may cause a hernia long term in her life. But I don't think it's not necessarily something you can have when you're pregnant. So it's not anything like diabetes or some of the other issues that can occur with pregnancy. So I don't think there would be a problem.
Okay. This person, what can be done for a person that suffers from CFS besides B12 shots and vitamins? This person has no energy. Please help.
Chronic fatigue syndrome is what that stands for. It's a very complex disease, to be honest with you. There's a lot of resources online to help you. There's literature out there, books written by physicians who studied this issue. So a lot of times you have to get on top of your depression, your sleeping, maybe check your hormones and get on some bioidentical hormones.
How does this person get rid of seizures?
A lot of times medications and ruling out other reversible causes. If they have anything intracranially, a lot of people don't. It's like diabetes, just the brain starts to have seizures, so medicines is what we normally do.
Okay, this person has been itching all over their body for about a week now. What could be the cause?
I think it's a patient I saw today that had that. It's very common. Liver disease, medications, dry skin, especially in the winter months. Get some good lotion. Antihistamines sometimes work really well. Hydroxyzine, which is a prescription medication we can use sometimes to try to get to the root cause of that. That can sometimes be a very frustrating illness. The more medical problems you have, the more diseases you have, the higher chance you're going to have itching.
All right, Dr. Levine, unfortunately we are out of time, but appreciate you stopping by. And as always, you can visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kftm.com, or post those questions every Monday on our KFTM News Facebook page.